speaking about the new days and how things are happening now, that's what brings you and I together. I'm talking to you in Utah right now. I'm sitting in Florida, and we have a wonderful webinar series lined up with you and Simone starting in January.
We do.
So
Yep.
tell me, so January 6th
So
at
let
8
me
p.m. New
tell
York
you
time.
what the listeners and the members of the Academy will have access to.
Yeah,
First,
please.
I'll do a theoretical foundation of what we call the 6 lessons approach to biomimetic dentistry. So it's a system of biomimetic dentistry that I've been teaching since 2003. So that's 18 years. A lot of people worldwide are obviously associating the name biomimetic restorative dentistry with Pascal Magnier. He'll be publishing a book or maybe 2 books next year. There'll be huge contributions. They will be the Old and the New Testament of,
Right.
references. I know that most people know that we have a Bible, and we'll call that the Bible of biomimetic dentistry. It's 900 pages. At some point, you have to, make some kind of interpretation or condensation. Where do you start? And so in my first lecture, I'll let all the doctors who are listening understand that there are basically 6 areas that you need to become expert in to become a biomimetic restorative dentist. And the first area is caries diagnosis and caries treatment, how to use caries detecting dye. The second idea in biomimetics is we have to be able to diagnose where sensitivity comes in a crack or a gap into dentin. So there's a diagnostic criteria we'll go over to show you how to understand when a filling or a crown is failing from a lack of a connection or a lack of a seal. And then in the third lesson, Pascal, covered it very well. I'm sure he always does. Immediate dentin sealing is something that is associated with every biomimetic restoration. And then I'll make some amplifications on the immediate dentin sealing and include the concept of a resin coating, which is key. It's fundamental. It was introduced in 1989 in Japan. Unfortunately, it was written in Japanese, so it didn't get to the United States. Probably 2003 is a real seminal paper that was published. But the idea is that all of the science that goes into every concept that Pascal or Simone or myself or Matt Najad talk about, it's all related to published science. It's not just an art, but we have some real reasons why we do things. The fourth lesson that we'll talk about in our discussion, it's the most difficult to understand, is called polymerization dynamics. So all of these composites that we use to connect a restorative material to the tooth, seal the tooth, they all move. They all have a little shrinkage. They all have a way that they bend and flex. And that concept, to control that, the easiest way to do that is the way that Matt Najad showed in his cases, and that's by using an indirect restoration. Mm-hmm. And of course, Pascal and his brother Michel wrote their first book together with indirect porcelain bonded restoration, showed immediate dentin sealing, and then we have a ceramic on top of that, connecting a ceramic and the immediate dentin sealing. That is the first step that most dentists learn. But then what if you have a large gap between your enamel replacement and your connection to the tooth? How do you connect that area, and how do you restore that area? The thicker it is, the more difficult it is. And so we'll go over that. And then this will tie into the presentation that Simone and I will give together. And that is a reconstruction.
Perfect.
Broken down anatomically tooth using stress reduction, which we call stress reduced direct composite, and we will add fiber. The fiber placement, we coined the term, came from Wendell Robertson wallpapering, but we'll also make some contributions to integrating the rib-on fiber placement with a new product. Well, it's 3 years old, but it's been tested for 3 years, and it's called Everex Flow, and the other product is Everex Posterior. So these 3 products, Rib-On, Everex Flow, and Everex Posterior, there are world experts in the science. I'll be doing a IG Live next Wednesday with Philip Ceulemans, who happens to be a world expert in the EverX and the EverX Flow. I think many of you have heard of Dave Veruto, and he's talked for a long time about his product, and we've used it since 2005 for 15 years. But this idea of putting fiber into a restoration, well, it's new to most dentists, but there are actually 3 reasons why you would do it. And we'll talk about all 3 of those reasons in the case that Simone and I will present, and he will also refer to that, I'm sure, in his lecture. So we'll have a lecture from me with the 6 lessons approach. Enamel replacement is lesson 5, and occlusion is lesson 6. And then Simone will protocol, which is called a stress reduced direct composite protocol, first published in 2002. We actually named it in 2009 in a paper that we wrote together, and then we've published in 2012 and 2017 additional papers. And this is another way to do biomimetic restorative dentistry. Unfortunately, when people hear this, there's a direct composite way to have long-term success. Everybody thinks, oh, that's got to be easier. Well, it's not. If you want to start biomimetics with the least amount of learning curve, you have a lab do your onlay or inlay, and you have a CAD CAM to mill your inlay or onlay, your partial coverage restoration. That's the easiest way to start. And we recommend all the doctors that we train to start out with a easier way. But if you desire to incorporate fiber and you desire to do a non-lab supported biomimetic restoration or non-CAD CAM restoration, then Simone is your guy. And Philip Ceulemans, who's got a PhD in fiber reinforced composite from ACTA University in Amsterdam, that we'll be talking next Wednesday with, he's the world's expert on this new material, EverX and EverX Flow. So we'll refer to that. And Philip Ceulemans has just completed a 3-day, very intense course that Simone gives. And so, you know, when you have a world expert, you know, pay you some money and spend 3 days with you, you got to have your ducks in a row, you know. But Philip was over the moon, happy with his interaction. And this is really true, Matt. You know, it's the best dentists in the world that want to get better. Think about that. You know,
I know a lot of biomimetic dentists, and I really do feel that about this community. You know, it's the best dentists wanting to get better at their craft and what they do. And so that was a great kind of summary of our first webinar with you coming up on the 6th, on the first Wednesday of the new year, which is, we're so happy to have you. Yep. And then the very one after that is going to be Simone, which you touched on a little bit. Maybe we'll get to do an interview with him. But you didn't really touch upon the third one in the series too much.
So the third one,
just give me a quick 30-second overview of that.
The third one. So the first 2, you know, you will get your money's worth. I mean, I think it's going to be $70. Is that our price point, Matt?
That's our price point. Yeah.
I tell you, for $70, this is like a bargain of the world, because I am going to be telling you exactly what you need to learn. And how to learn it. And that will be through the published literature that I'm posting on my Instagram account. And then we're
that's like your baseline.
That's the baseline. That's the framework. So we're giving you the framework. And if you go to my Instagram account, you will be able to see all the literature that we study. And if you go to my son Davey's Instagram account, he has posted 450 teeth restored with these protocols. So you can just look at multi-pictures, you know, 5 to 10 pictures on each case, and you can see exactly and relate that to the steps. And then when Simone gives the presentation, he'll have his theoretical that will tie in to the 6 lessons we've taught together for 10 years. But then the last day, or the last lecture, we will show you a case step by step and have a video for it. And it's the most complicated case you're ever going to have. Well, maybe with a few exceptions, I would say. I mean, every case is different, but if you understand that third lecture, what Simone is doing, you'll see it. And then I will explain why he's doing it and how it relates to the 6 lessons and how it relates to what Simone calls his 6-step protocol for treating in a biomimetic way.
So
you'll see it. And so you're just going to see what we've been talking about. Demonstrate.
So this is going to happen live on the live webinar too, right? Or you'll be commenting live.
Yeah, exactly. In other words, the case has been recorded, so the video, you know, is 5 minutes, but we will take step by step and break that 5 minutes down, you know, 15 seconds by 15 seconds, a play by play, and so you should be able to reverse engineer pretty much the whole thing.
So January is going to be pretty jam-packed with David Alleman over and Simone over at the Academy of Biomimetic Dentistry. You are our main cheese for this month coming up.
Yeah. So you know
what would you say to all dentists about that? Do you want them to go to all 3 of them, or what would you say if they're on the fence or they don't know what to do?
I'm just gonna, you know, this shouldn't be anything except the truth. If you are going to master biomimetic dentistry, it's going to cost you at least 100 hours. So what's your hourly rate as a dentist? $200 an hour. So if you do 100 times 200, that's $20,000 bucks. Is that right, Matt? Do the math. You got 4 zeros, right? So if you got 4 zeros and a 2, that's $20,000 out of your office. In other words, you could be in your office making $20,000 treating patients with any kind of dentistry. You're going to have to sacrifice that chair time to learn how to do this. But the benefits are so great that your patients are going to love it, and you're going to love the predictability, lack of stress. When you prevent a root canal on a patient, the patient has just saved $1,000. I mean, in Utah, probably more in New York and California. So the value of changing your office to a biomimetic office, it's going to cost you some time, but for $210 for those 3 lectures, I mean, you're going to have the foundation for what will change your life. It'll cost you more to get training with Pascal or Didier Dici or Matt Najad or Dave Jerdol or myself.
And that's exactly where the Academy comes in. We definitely support and encourage all of our members to go on and study with each and any of our scientific advisors.
Yeah. And I mean, just to throw out a number, I'm just saying, I don't know any masters of biomimetic dentistry that have spent less than $10,000. Now that's might be over years, but it's like, you don't get it, you know, in one lecture. You don't get it in one hands-on demonstration. But with Instagram, I think it's getting sped up and it becomes less expensive. But you are not going to be, you know, looking at training that could cost you $100,000 that could not be applied into a normal, regular practice. What you will learn in the biomimetic protocols, you will start the next day. In other words, if you don't use caries detecting dye, you will buy caries detecting dye the next day. That's $50.
That's great. That's great.
And the bonding system, the bond FL, I have it on my own, like these 2 other bonding systems that have the same goals and predictability. We'll talk about that. But the idea is we will save you a ton of money by understanding what is the goal and how to achieve that goal to restore it to one time. I mean, this is restored one and never has to be restored again. And we have 20 years of success. So 20 years isn't forever, but you know, it's a long time, and we expect it to be longer in most of these.
So I'm going to wrap up this interview with you, Dr. Alleman, and because this video that we just created is actually going to be living on the landing page or the web page where we're selling our series. So if you're still watching this video and if you're interested in joining us, scroll down and click that buy button, and we will see you on January 6th.
In January. All right.
That's right. If you're watching this live on Facebook, we will be announcing it to everybody real soon here now that we have the video. David, as always, it's great hanging out with you, my friend.
All right. We'll see you in January.